and then we are going to make sure that we have right dose, right documentation, right dose, right time, right patient, and right medication for you, and the right route. So now that that's all triple verified, I have that going. I want to perform hand hygiene. I want to ask you now, what is your preferred medication to start with? Okay, we want to start with the insulin. I want to also help you get into your most comfortable position. So she's already in her most comfortable position. Or she's now in her most comfortable position. I've done hand hygiene. I've done gloves. Now that I've done these gloves, I want to pull my patient's or expose my patient's abdomen. I want to assess the abdomen for any lesions, redness, inflammation, bony prominences, or trauma. There are no signs of that. I want to locate where I would be doing my my administration with the syringe. I would want to choose an area 1 inch away from the umbilicus, and then and that's where I would do it. I would grab a antimicrobial swab or pad, which would just be an alcohol pad, and I would choose that area, and I would move the same area that was 1 inch away from the umbilicus. I would clean in circular motions, starting from the center going outward, and then I would take my non-dominant hand. So this is, like I said already, with clean hands that have been gloved. So I would take my dominant hand for my syringe. I would use my non-dominant hand to hold my patient's subcutaneous fat, to pinch it. You can come here and see that I'm pinching. I would want to uncap my needle, and I would want to go in at about a 45 to 90 degree angle. I would choose that angle depending on how much subcutaneous tissue is in this area. So I'm going to go in at a 45 degree angle, and I'm going to make sure that I'm sorry, I pressed down, I didn't mean to do that. I'm going to make sure I'm going in at a 45 degree angle and let my patient know that there is going to be a sensation because of the needle prick. So I am going to go, and I'm going to firmly go in at 45 degree angle. I am going to let go my non-dominant hand to stabilize. I'm going to stabilize my syringe. I'm going to use my dominant hand to push this plunger down so that I can insert the medication into my patient. I am going to release my non-dominant hand, come out of the injection site the same angle that I went in. I want to use my non-dominant hand to put a gauze on to apply pressure, cotton ball or gauze onto the injection site. I also want to cap my needle, or apply my safety to my needle, and then dispose of my needle away in the sharps. So that will be my sharps container. I want to now assess the area for any redness, bleeding, any excessive trauma from the injection, or any adverse effects or reactions. So now that none of that is noted, I want to make sure that I have the area cleaned and bandaged up properly, and then I want to make sure that I dispose of any soil products that I have used so far, and I am going to then want to perform hand hygiene. So I've thrown everything away from that, or I would take my gloves off, I'm sorry, and then perform hand hygiene. And then at this point, I would want my patient I would raise the head of my patient's bed to a 30 degree angle, at least a 30 degree angle. I would then, like I've said, I've already washed my hands. I would make sure that I had water available to my patient, which I do. It would have a straw in it. I want to then administer the pill, and since they do have the ability to swallow on their own, I would just give them the pill and watch them take it. I would now verbalize that I've seen the patient take it and swallowed the medication. So you swallowed the medication, that's great. I want to then I want to then grab all of the things from the medication that I had, the wrappings and everything, and discard of it in the right receptacle. I want to perform hand hygiene after I do that, after I discard of everything. So after I get rid of everything, I want to perform hand hygiene, and then I'm going to lower your bed into the lowest position. I'm going to lock it. I am going to put the side rails up if applicable, and then I am going to make sure that you have a call light that is within reach. And I want to then just assess you for the last time for your pain and your comfort level, and see if you did it. If you have any, if you're having any adverse reactions to the medication, I will come back and assess that again. And then right now I would just thank you for your time and go and perform my documentation, which would include me documenting that you got your medication at the right time, the right route, you are the right patient, and the right chart that I am documenting on for you. And I want to make sure that it was the right medication you received, the right dose, and in the right route. And then that will be all. I will just leave. Thank you.